We're going to do some stress tests. So the first test is the anterior stress test or the distraction test. So I'm going to palpate the patient's ASIS on both sides. I'm going to place my hand on both ASISs, and then I'm going to add a lateral distraction force. So this is going to cause some compression posteriorly and a little bit of distraction anteriorly. So I'm going to be observing the patient's physiognomy and their reactivity, asking about any reproduction of symptoms. And we're holding this at an end range, and I'm going to be holding that for about 30 seconds. And after 30 seconds, I'll go ahead and ask if there was any reproduction of symptoms.
Nope.
And no reproduction of symptoms means that, it was a negative test. The next test we're going to do for this patient is called the sacral thrust test. So what we're going to do is palpate the PSIS, and that is going to be in line with the S2 vertebrae. So I'm moving medially, I should be over S2, and then I'm going to move inferiorly to the S3 spinous process. I'm going to take my pisiform and place it on the S3 vertebrae and use my other hand as reinforcement, and I'm going to apply 6 thrusts. Asking about the patient's reactivity, any reproduction of symptoms. Alright. And a positive test would be a reproduction of symptoms at the SI joint or the groin. The patient reported no reproduction of symptoms, so they would be negative for this test. Acetabular labral pathology tests, beginning with the scour. So for the scour, we're going to have their hip flexed, and we're going to create an axial compression through their hip. We're going to do 2 aspects of it. There's going to be an internally rotated with adduction and an externally rotated with abduction. So internal with AD first, adding an axial compression and scouring the joint. Any issues, observing the reactivity. Alright. And then we're going to go into abduction and external rotation. Any issues? Alright. So this patient would be negative for this test. A positive test would be a reproduction of symptoms. However, like any test, this test alone has poor diagnostic utility on its own, so we would do another test just to confirm our findings. The next test we're going to do is called the Fitzgerald test, and there are 2 Fitzgerald tests. There's one for anterior labral tears and one for posterior labral tears. So we'll start with the anterior labral tear. We're going to start in full flexion, we're going to be abducted, and we're going to be externally rotated. So we're going to go from this position here, and then we're going to go into extension, adduction, and internal rotation. So again, if you want to do that. And I'm feeling for any clicking, asking if there's any reproduction of symptoms. And so the patient would be negative for an anterior labral tear. To do a posterior labral tear test, we are going to start in adduction, internal rotation, and full flexion. And then we're going to bring the patient down into abduction, extension, and external rotation. Again, asking if there's any symptoms or feeling for any clicking or mechanical symptoms.
No.
Alright. Alright, and so the patient would be negative for that test as well. Like any test, the diagnostic utility on its own is not the greatest. However, according to the article, these tests on their own do have a 100% sensitivity. So if the patient was negative for either of those Fitzgerald tests, then we would be able to rule out an acetabular labral tear. The next patient is complaining of some knee pain, and pain particularly behind her kneecap. So we're going to do some tests for patellofemoral pain syndrome. So the first test is a dynamic test. It's called the Waldron test. And we're going to do it while the patient is going from extension and flexion. However, I'm going to be compressing her patella into the trochlear notch of her femur while she's moving. So adding some compressive forces here. And we're looking for any pain or reproduction of symptoms. Anything?
Nope.
Alright. And because the patient didn't have any reproduction of symptoms or any pain, she would be negative for this test. The next test is called the Zoller test. And so this involves me having the patient be completely relaxed so that I can mobilize her patella a little bit. And what we're going to do is move the patella inferiorly, and I'm going to block the patella so that it can't move superiorly during a quad set. So I'm going to have the patient just gradually flex her quad. Alright, perfect, and I can feel the patella trying to go superiorly. And do you have any pain or reproduction of symptoms with this?
No.
So with this test you do have to be careful because it is likely that you're going to cause some discomfort even with patients without a pathology. So a positive test would be a reproduction of symptoms or some pain behind the patella. Next we're going to do the medial plica test. So this again involves me moving the patient's patella, and this time I'm going to move it medially. So as I move it medially with the base of my hand, I'm also going to be adding a little bit of an internal rotation force to her distal tibia. But while I'm doing that, we're kind of flexing and extending the patient's knee at the same time. So while we're doing this, I'm feeling for a little bit of crunches and some snapping and mechanical symptoms, which I do feel a little bit. Alright. Any pain?
No.
Alright. So the patient would be positive for this test because I did feel some mechanical symptoms with some snapping and clicking in there as we were moving. The next test is going to be the medial plica shelf test. So I'm just going to use a little bit of a bolster. I'll just use my leg in this case. And all I'm going to do here is just add a little bit of a medial force to her patella. And again, feeling for any clicking or any mechanical symptoms, any reproduction of pain or symptoms.
No.
No. And I'm not feeling any mechanical symptoms with this test, so the patient would be negative for this test. The first test we're going to do for the ankle is going to be an anterior drawer test. So this is going to test for an inversion ankle sprain or a rupture of the ATFL ligament. So what we're going to do is just bring the whole foot essentially anteriorly while we're stabilizing the tibia and fibula. So I'm going to go up here and stabilize these bones while I grab onto the calcaneus, and again I'm just bringing the foot anteriorly. I'm not bringing it into a dorsiflex position. I'm just moving the entire thing anteriorly while holding the tibia and fibula in place. And a positive test would be increased laxity compared to the other side. The next test is called the squeeze test or the Morton squeeze test, and this is going to test for a neuroma. Typically the neuromas are going to be between the digits, so what we're going to do is cause some compression between the digits to see if that reproduces symptoms. So we can do that with two hands, like so, compressing the digits together there, or we can do that with one hand, like this, also compressing the digits together. And if the patient does report a reproduction of symptoms between their digits or between their toes, we would be able to say that that is a positive result for a Morton's neuroma. The next test we're going to do is called the navicular drop test. So what we've done is we've marked the medial aspect of the medial malleoli, the navicular tubercle, and the medial aspect of the first metatarsal head. So what we're going to do is place the patient in subtalar neutral. Too much internal rotations causes too much pronation, and too much external rotation causes too much supination. So we're going to place it subtalar neutral, just like that. And go ahead and keep everything still. And then what we're going to do is mark with a note card the height of the navicular tubercle. Alright, and then we're going to ask the patient to go ahead and stand up and go weight bearing. Perfect. And then we're going to mark the height of the navicular tubercle again. Alright, and then we're going to measure the distance between those two marks, and a positive for this test is going to be greater than 10 millimeters. So it looks like she is negative for this test.